Question 1. Process analysis reveals that a licensed professional clinical counselor, LPCC, is working with a new client who identifies as transgender and has presented with symptoms of anxiety and depression. The LPCC has limited prior experience working directly with transgender individuals. Which of the following approaches best aligns with the LPCC ethical and professional responsibilities in this situation? Option A. Avoid discussing the client's transgender identity to prevent making the client uncomfortable, and instead focus solely on the presented symptoms of anxiety and depression. Option B. Focus the therapeutic sessions primarily on exploring the client's transgender identity as the root cause of their anxiety and depression, without exploring other potential contributing factors. Option C. Actively seek out continuing education and supervision focused on working with transgender clients, and integrate knowledge of minority stress and gender-affirming care into the therapeutic approach. Option D. Proceed with general therapeutic interventions, assuming that standard anxiety and depression treatment protocols will be sufficient without specific consideration of the client's transgender identity. The correct answer is C. Actively seek out continuing education and supervision focused on working with transgender clients and integrate knowledge of minority stress and gender-affirming care into the therapeutic approach. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the LPCC responsibility to provide culturally competent and ethically sound care to a client from a marginalized population. The challenge lies in navigating potential biases, understanding the unique lived experiences of an LGBTQ+ individual, and ensuring that therapeutic interventions are not only effective, but also affirming and respectful of the client's identity and history. The LPCC must move beyond superficial understanding to a deep appreciation of how societal stigma, discrimination, and internalized homophobia can impact mental health. This requires self-awareness of one's own potential biases and a commitment to ongoing learning. Correct approach analysis. The correct approach involves actively seeking out and integrating knowledge about LGBTQ+ affirmative therapy and the specific mental health concerns that may disproportionately affect this population. This includes understanding the impact of minority stress, coming out processes, family acceptance or rejection, and the potential for trauma related to discrimination. Best professional practice, as guided by the LPCC Ethical Code, e.g., ACA Code of Ethics, which is often a foundational document for LPCC in many U.S. states, mandates that counselors provide services that are respectful of diversity and avoid imposing their own values. Specifically, ethical principles of competence and non-discrimination require counselors to gain the necessary knowledge and skills to work effectively with diverse populations, including the LGBTQ+ community. This approach demonstrates a commitment to client welfare and upholds the standard of care expected of a licensed professional. Incorrect approaches analysis. One incorrect approach involves assuming that general counseling principles are sufficient without specific attention to the client's LGBTQ+ identity. This fails to acknowledge the unique stressors and experiences that can impact the mental health of LGBTQ+ individuals, potentially leading to misdiagnosis, ineffective treatment, or even harm. This violates the principle of competence, as the counselor is not adequately prepared to address the client's specific needs. Another incorrect approach is to pathologize the client's identity or to view their LGBTQ+ status as the sole cause of their distress, without exploring other contributing factors. This reflects a lack of cultural humility and can lead to discriminatory practices, directly contravening ethical guidelines that prohibit discrimination based on sexual orientation or gender identity. A third incorrect approach is to avoid discussing the client's LGBTQ+ identity altogether, perhaps out of discomfort or fear of saying the wrong thing. While well-intentioned, this can inadvertently communicate to the client that their identity is not important or is something to be hidden, which can be invalidating and hinder the therapeutic alliance. This also falls short of the ethical obligation to provide comprehensive and relevant care. Professional reasoning. Professionals should employ a decision-making process that prioritizes client welfare and ethical adherence. This involves 1. Self-reflection to identify potential biases and areas of limited knowledge. 2. Seeking out continuing education and supervision specifically related to working with diverse populations, including LGBTQ+ individuals. 3. employing a client-centered approach that actively solicits the client's perspective on their experiences and identity. 4. Consulting ethical codes and relevant professional literature when faced with complex ethical dilemmas. 5. Prioritizing the development of a strong, trusting therapeutic relationship built on respect and affirmation. Question 2. Implementation of humanistic counseling principles with a client who expresses a strong desire to make significant life changes, such as leaving a stable job and relationship to pursue an artistic passion, requires the licensed professional clinical counselor, LPCC, to navigate the client's subjective experience of self-actualization, while also considering potential real-world impacts. Which of the following approaches best reflects the LPCC ethical and professional responsibilities within the California regulatory framework? Option A. Advise the client that their current job and relationship are likely hindering their true potential and encourage them to make the drastic changes immediately to achieve self-actualization. Option B. Focus solely on the client's immediate emotional state and validate their desire for change without discussing any potential risks or alternative strategies, as this would interfere with their authentic self-discovery. Option C. Immediately support the client's decision to leave their job and relationship, emphasizing that their pursuit of happiness and self-expression is the ultimate therapeutic goal, regardless of external circumstances. Option D. Validate the client's feelings and aspirations, exploring the potential positive outcomes of pursuing their passion, while also gently encouraging reflection on the practical implications and potential challenges of such a significant transition, fostering a collaborative decision-making process. The correct answer is D. Validate the client's feelings and aspirations, exploring the potential positive outcomes of pursuing their passion, while also gently encouraging reflection on the practical implications and potential challenges of such a significant transition, fostering a collaborative decision-making process. Explanation. This scenario presents a professional challenge because the LPCC must balance the client's expressed desire for self-determination and personal growth, central to humanistic theories, with the ethical imperative to ensure client safety and well-being. The client's perception of their own progress, while valid from a humanistic perspective, may not fully account for potential risks or the objective impact of their choices on their relationships and functioning. Careful judgment is required to validate the client's subjective experience, while also providing guidance that promotes healthy adaptation and prevents harm. The correct approach represents best professional practice because it integrates the client's humanistic drive for self-actualization with a responsible, ethically grounded therapeutic stance. By acknowledging and validating the client's feelings and aspirations, the LPCC honors the core tenets of humanistic psychology, such as unconditional positive regard and empathy. Simultaneously, by gently exploring potential consequences and offering alternative perspectives, the LPCC fulfills their ethical duty of care and beneficence, ensuring that the client's pursuit of autonomy does not lead to detrimental outcomes. This approach aligns with the California Board of Behavioral Sciences, BBS, regulations, which emphasize the importance of client welfare, and the LPCC responsibility to provide competent and ethical services that promote client growth while safeguarding against harm. An incorrect approach that focuses solely on the client's immediate feelings without exploring potential negative consequences would fail to uphold the LPCC duty of care. This would be a regulatory and ethical failure, because it neglects the responsibility to assess risk and guide clients toward choices that are both personally fulfilling and objectively beneficial, potentially leading to harm or a lack of sustainable progress. Another incorrect approach that dismisses the client's subjective experience in favor of an external, objective assessment would violate the humanistic principle of respecting the client's inherent worth and their unique perspective, also representing an ethical failure to provide client-centered care. A third incorrect approach that imposes a predetermined outcome or solution on the client would undermine their autonomy and self-determination, directly contradicting humanistic ideals and potentially violating ethical guidelines regarding client empowerment. Professional decision-making in such situations requires a process of careful ethical deliberation. The LPCC should first actively listen to and empathize with the client's perspective, validating their feelings and experiences. Then, they should collaboratively explore the client's goals and aspirations, linking them to humanistic principles of growth and self-actualization. Following this, the LPCC should gently introduce a consideration of potential consequences, both positive and negative, encouraging the client to engage in critical thinking about their choices. This process involves ethical reasoning, drawing upon professional codes of conduct and regulatory requirements to ensure that the client's autonomy is respected while their safety and well-being are paramount. Question 3. The monitoring system demonstrates that a licensed professional clinical counselor, LPCC, is about to begin a telehealth session with a client. The client has previously consented to telehealth services generally, but the counselor has not specifically confirmed the client's current location or the privacy of their surroundings for this particular session, nor has the counselor verified the encryption status of the communication platform being used for this session. The counselor is aware that the client has recently moved and is experiencing increased family stress. What is the most ethically and legally sound course of action for the counselor to take before commencing the session? Option A. Initiate the session and address any potential privacy issues that may arise during the conversation. Option B. Briefly confirm with the client that they are in a private location and that the communication platform is secure, and obtain their explicit consent for this specific session's telehealth modality before proceeding. Option C. Send a follow-up email after the session to document that the client was in a private location and that the platform was secure. Option D. Proceed with the session, assuming the client will inform the counselor if there are any privacy concerns, given their prior general consent to telehealth. The correct answer is B. Briefly confirm with the client that they are in a private location and that the communication platform is secure, and obtain their explicit consent for this specific session's telehealth modality before proceeding. Explanation. This scenario presents a professional challenge due to the inherent complexities of telehealth, specifically concerning client privacy, informed consent, and the counselor's duty to ensure a secure therapeutic environment, all within the framework of LPCC regulations. The counselor must balance the convenience of telehealth with the stringent ethical and legal obligations to protect client confidentiality and well-being. Careful judgment is required to navigate potential breaches and maintain professional standards. The correct approach represents best professional practice because it prioritizes client safety and confidentiality by proactively addressing potential telehealth risks. This involves obtaining explicit, informed consent regarding the specific telehealth modalities, including the platforms used, data security measures, and the client's responsibilities in maintaining privacy. It also necessitates verifying the client's location and ensuring they are in a private setting, thereby upholding the LPCC duty to practice competently and ethically, as mandated by relevant state statutes and professional ethical codes that emphasize client welfare and confidentiality in all practice settings, including telehealth. An incorrect approach that involves proceeding with the session without confirming the client's privacy or obtaining updated consent fails to meet the standard of care. This constitutes a regulatory and ethical failure because it potentially violates the client's right to privacy and confidentiality. As protected by state licensing laws and ethical guidelines, it demonstrates a lack of due diligence in ensuring a secure therapeutic environment, which could lead to a breach of confidentiality and harm to the client. Another incorrect approach, such as relying solely on the client's assurance of privacy without any verification, is also professionally unacceptable. This overlooks the counselor's affirmative duty to take reasonable steps to protect client information. Ethically, this is a lapse in professional responsibility, as it places undue trust on the client to manage a situation that requires professional oversight and technical understanding of telehealth security. A further incorrect approach, which involves using unencrypted communication channels for sensitive discussions, represents a significant ethical and regulatory violation. This directly contravenes requirements for maintaining confidentiality and data security, potentially exposing client information to unauthorized access and violating HIPAA or equivalent state privacy laws. It demonstrates a failure to implement appropriate technological safeguards, a core ethical and legal responsibility when providing telehealth services. The professional decision-making process for similar situations should involve a systematic assessment of telehealth risks and benefits. This includes 1. Reviewing and updating informed consent documents to specifically address telehealth. 2. Assessing the technological security of all platforms used. 3. Verifying the client's environment and privacy measures. 4. documenting all telehealth procedures and consent. And 5. Remaining current with evolving telehealth regulations and best practices. Question 4. The efficiency study reveals that a client presenting with significant anxiety is seeking immediate relief from panic attacks. The LPCC, trained in psychodynamic theories, is considering how best to address this client's needs. Which of the following therapeutic directions would most effectively align with psychodynamic principles and promote lasting change? Option A. Facilitating a deep exploration of the client's early attachment pattern, significant interpersonal relationships, and recurring emotional and behavioral themes to foster insight into the underlying causes of their anxiety. Option B. Directly interpreting the client's recent nightmares as symbolic representations of their current work-related stressors, advising them to confront their boss. Option C. Recommending a strict regimen of exercise, dietary changes, and sleep hygiene improvements as the primary intervention for anxiety reduction. Option D. Primarily focusing on teaching the client a range of relaxation techniques and cognitive restructuring strategies to manage acute anxiety symptoms in the moment. The correct answer is A. Facilitating a deep exploration of the client's early attachment patterns, significant interpersonal relationships, and recurring emotional and behavioral themes to foster insight into the underlying causes of their anxiety. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a client's presenting problem appears to be a superficial manifestation of deeper, unresolved conflicts. The LPCC must navigate the ethical imperative to provide effective treatment while adhering to the principles of psychodynamic theory, which emphasizes understanding the unconscious roots of distress. The challenge lies in distinguishing between symptom relief and genuine therapeutic progress, and in ensuring that interventions are aligned with the client's underlying psychodynamic needs, rather than merely addressing surface-level complaints. This requires careful assessment and a nuanced understanding of psychodynamic concepts. Correct approach analysis. The most effective approach, grounded in psychodynamic principles and ethical practice for LPCC, involves exploring the client's early life experiences, significant relationships, and recurring patterns of thought and behavior. This aligns with the core tenets of psychodynamic theory, which posits that current difficulties are often rooted in past experiences and unconscious conflicts. By delving into these areas, the LPCC facilitates insight and understanding, which are crucial for lasting change. This approach respects the client's autonomy by empowering them to explore their own internal world, and fosters a therapeutic alliance built on trust and exploration, consistent with ethical guidelines for client-centered care and professional competence. Incorrect approach is analysis. One incorrect approach would be to focus solely on teaching coping mechanisms for the immediate anxiety symptoms. While symptom management can be a component of therapy, a purely behavioral or skills-based approach, divorced from exploring underlying psychodynamics, risks providing only temporary relief without addressing the root cause. This could be considered ethically problematic if it leads to a failure to provide comprehensive care, or if it prolongs treatment unnecessarily by not addressing the fundamental issues. It may also violate the LPCC duty to provide treatment that is appropriate to the client's needs as understood through a psychodynamic lens. Another incorrect approach would be to immediately interpret the client's dreams as direct, literal representations of their current problems. While dream analysis is a tool in psychodynamic therapy, a rigid, literal interpretation without considering the client's associations, the therapeutic context, and the symbolic nature of dreams can be premature and potentially damaging. This could lead to misinterpretations, alienate the client, and hinder the development of a strong therapeutic alliance. Ethically, it demonstrates a lack of clinical judgment and a superficial application of psychodynamic techniques, potentially leading to ineffective treatment. A third incorrect approach would be to dismiss the client's anxiety as simply a result of poor lifestyle choices and recommend immediate lifestyle changes without further exploration. This approach ignores the psychodynamic perspective that anxiety is often a signal of deeper internal conflict or unmet needs. It fails to acknowledge the potential for unconscious factors to influence the client's current state. Ethically, this represents a failure to conduct a thorough assessment and a departure from psychodynamically informed practice, potentially leading to an incomplete or inappropriate treatment plan. Professional reasoning. When faced with a client presenting with anxiety, A psychodynamically oriented LPCC should engage in a comprehensive assessment that goes beyond surface-level symptoms. This involves actively listening to the client's narrative, exploring their relational history, identifying recurring patterns, and considering the potential influence of unconscious processes. The decision-making process should prioritize building a strong therapeutic alliance, fostering insight, and facilitating the client's exploration of their internal world. Interventions should be tailored to the individual client's psychodynamic needs, with a focus on understanding the origins of their distress rather than solely on symptom management. Ethical practice mandates that LPCC operate within their scope of competence and provide treatment that is both effective and aligned with established theoretical frameworks. Question 5. Benchmark analysis indicates that a licensed professional clinical counselor, LPCC, is conducting a therapy session with a client who has a history of depression. During the session, the client states, "Sometimes I just feel like I can't go on anymore, and I've thought about how I could just end it all." The LPCC needs to determine the most appropriate and ethically sound course of action according to California's regulatory framework for LPCC. Option A. Immediately terminate the session and contact the client's emergency contact or local authorities, assuming the client is in imminent danger. Option B. Inform the client that due to the seriousness of their statement, confidentiality must be broken, and their family will be contacted to ensure their safety without further discussion. Option C. Reassure the client that these feelings are common with depression and encourage them to focus on positive thoughts without further probing into the specifics of their statements. Option D. Directly ask the client about their specific plan, intent, and access to means for self-harm, while also exploring their reasons for living and any protective factors, and document this assessment thoroughly. The correct answer is D. Directly ask the client about their specific plan, intent, and access to means for self-harm, while also exploring their reasons for living and any protective factors, and document this assessment thoroughly. Explanation. Scenario analysis. This scenario presents a common yet ethically complex situation where a therapist must balance a client's immediate emotional distress with the legal and ethical mandates of informed consent and the limits of confidentiality. The challenge lies in accurately assessing the client's intent and capacity while upholding the client's right to self-determination and privacy, as defined by LPCC regulations. The therapist must navigate the potential for harm to the client or others, which triggers specific reporting obligations, without prematurely breaching confidentiality or misinterpreting the client's expressions. Correct approach analysis. The correct approach involves a thorough, direct, and non-judgmental exploration of the client's statements regarding self-harm. This aligns with LPCC ethical guidelines and California law, e.g., Business and Professions Code sections related to mental health professionals and confidentiality, which emphasize the therapist's duty to assess risk when a client expresses suicidal ideation. The therapist must gather specific information about the client's intent, plan, means, and protective factors. This process respects the client's autonomy by engaging them in the assessment and safety planning, while simultaneously fulfilling the professional obligation to protect life. Documenting this process thoroughly is also a critical component of best practice and regulatory compliance. Incorrect approaches analysis. One incorrect approach involves immediately terminating the session and contacting emergency services without a comprehensive risk assessment. This violates the client's right to privacy and self-determination by assuming imminent danger without sufficient evidence. LPCC regulations and California law require a good faith effort to assess the risk, and where possible, involve the client in safety planning before resorting to involuntary interventions. This approach also fails to explore the underlying issues contributing to the client's distress. Another incorrect approach is to dismiss the client's statements as mere expressions of emotional pain without further inquiry. This is a significant ethical and legal failure. LPCC standards and relevant statutes mandate that therapists take all expressions of suicidal intent seriously and conduct a thorough risk assessment. Ignoring such statements can lead to tragic outcomes and constitutes a breach of professional duty of care. A third incorrect approach is to immediately break confidentiality and inform a family member without the client's consent or a clear, imminent danger assessment. While involving support systems can be beneficial, it must be done ethically. LPCC guidelines and California law permit breaches of confidentiality in specific circumstances, such as imminent danger to self or others. But this requires a careful, documented assessment, and often a discussion with the client about the necessity of such a breach. Acting solely on a perceived need for support without a direct risk assessment is not compliant. Professional reasoning. Professionals should employ a structured decision-making process that begins with active listening and empathic engagement. When a client expresses suicidal ideation, the immediate priority is a comprehensive risk assessment. This involves asking direct questions about intent, plan, means, and timing. Simultaneously, the therapist should explore protective factors and the client's reasons for living. The decision to breach confidentiality or involve external resources should be based on the outcome of this assessment, guided by the LPCC Code of Ethics and relevant California statutes. Documentation of the assessment, the rationale for decisions, and any actions taken is paramount. Collaboration with supervisors or legal counsel may be necessary in complex cases. Question 6. Investigation of how an LPCC might ethically and effectively integrate existential theories into their practice when a client expresses profound feelings of meaninglessness and a fear of death, considering the regulatory framework for licensed professional clinical counselors. Which of the following approaches best aligns with professional standards and ethical guidelines? Option A. Facilitating a collaborative exploration of the client's values, life choices, and sources of meaning, while acknowledging the inevitability of death as a catalyst for living authentically, within the context of established therapeutic interventions for anxiety and depression. Option B. Engaging the client in a philosophical debate about the nature of existence and the ultimate futility of human endeavors, encouraging them to accept nihilism as a rational response to life's inherent lack of objective meaning. Option C. Dismissing the client's existential concerns as beyond the scope of clinical counseling, suggesting they seek guidance from a philosopher or spiritual leader instead, as these issues are not clinically relevant. Option D. Directly advising the client on what constitutes a meaningful life, based on the LPCC personal philosophical beliefs, and reassuring them that death is not a significant concern if they adhere to the LPCC prescribed path. The correct answer is A. Facilitating a collaborative exploration of the client's values, life choices, and sources of meaning, while acknowledging the inevitability of death as a catalyst for living authentically, within the context of established therapeutic interventions for anxiety and depression. Explanation. This scenario presents a professional challenge due to the LPCC need to integrate existential principles into therapeutic practice, while adhering to the ethical and legal standards governing licensed professional clinical counselors in the specified jurisdiction. The core of the challenge lies in applying abstract philosophical concepts to concrete client situations in a way that is both therapeutically effective and ethically sound, ensuring client welfare and professional accountability. Careful judgment is required to distinguish between philosophical exploration and the provision of therapeutic interventions that are evidence-informed and within the scope of practice. The correct approach represents best professional practice because it demonstrates a nuanced understanding of existential theory and its application within the LPCC scope of practice. It prioritizes the client's subjective experience and their search for meaning, while grounding interventions in established therapeutic modalities that are recognized and regulated. This approach aligns with ethical guidelines that emphasize client autonomy, beneficence, non-maleficence, ensuring that the exploration of existential concerns does not lead to unsupported or potentially harmful therapeutic directions. It also reflects a commitment to ongoing professional development and the integration of theoretical knowledge with practical application in a responsible manner. An incorrect approach that focuses solely on philosophical debate without therapeutic application fails to meet the professional obligations of an LPCC. This would be a regulatory and ethical failure because it deviates from the core function of providing clinical counseling services aimed at alleviating distress and promoting well-being. It risks engaging the client in abstract discussions that may not address their immediate needs or contribute to therapeutic progress, potentially violating the duty of care. Another incorrect approach that attempts to impose a specific existential worldview on the client represents a significant ethical failure. This violates the principle of client autonomy and can be seen as a form of undue influence or therapist bias, which is contrary to ethical codes that mandate objectivity and respect for diverse client values and beliefs. Such an approach could also be considered a scope of practice violation if it ventures into areas beyond the LPCC training and licensure. A further incorrect approach that dismisses existential concerns as irrelevant to clinical practice is also professionally problematic. This demonstrates a lack of understanding of the profound impact existential issues can have on mental health and well-being. Ethically, it could be seen as a failure to provide comprehensive care and to adequately assess and address all contributing factors to a client's distress, potentially leading to incomplete or ineffective treatment. The professional decision-making process for similar situations should involve a thorough assessment of the client's presenting concerns, identifying any underlying existential themes. This should be followed by a consideration of how these themes manifest in the client's life and impact their functioning. The LPCC should then consult relevant theoretical frameworks, including existential theories, to inform their understanding, but always prioritize interventions that are within their scope of practice, evidence-informed, and ethically aligned. This involves a continuous process of self-reflection, seeking supervision or consultation when necessary, and ensuring that therapeutic goals are collaboratively established with the client, respecting their agency and individual journey. Question 7. What factors determine whether an LPCC can ethically continue to provide clinical services to a client when the LPCC has a pre-existing, non-professional relationship with a close family member of the client? Option A. The LPCC personal belief that they can remain objective, even if the dual relationship is significant. Option B. The client's expressed desire to continue therapy regardless of the dual relationship. Option C. The perceived social or professional standing of the client's family member in the community. Option D. The nature and proximity of the dual relationship, the potential for exploitation or harm to the client, and the LPCC ability to maintain professional objectivity and boundaries. The correct answer is D. The nature and proximity of the dual relationship, the potential for exploitation or harm to the client, and the LPCC ability to maintain professional objectivity and boundaries. Explanation. This scenario presents a professional challenge because the LPCC personal relationship with the client's sibling creates a potential for blurred boundaries and compromised objectivity. The core of the challenge lies in the inherent conflict between the LPCC duty to provide unbiased, client-centered care and the potential for personal feelings or obligations to influence therapeutic decisions. Careful judgment is required to assess the degree of risk and to implement appropriate safeguards or to terminate the professional relationship if necessary. The correct approach represents best professional practice because it prioritizes the client's well-being and upholds the ethical standards of the counseling profession. Specifically, it aligns with the ethical principles of avoiding dual relationships that could impair professional judgment or exploit the client. By proactively assessing the potential for harm and taking steps to mitigate it, or by recognizing the impossibility of maintaining objectivity and terminating services, the LPCC demonstrates a commitment to ethical conduct and client welfare as mandated by professional codes of ethics and relevant state licensing board regulations. This approach emphasizes informed consent, clear boundaries, and the client's best interests above all else. An incorrect approach that involves proceeding with therapy without acknowledging or addressing the dual relationship fails to recognize the inherent risks. This constitutes a regulatory and ethical failure because it violates the principle of avoiding conflicts of interest and dual relationships that could exploit or harm the client. It demonstrates a lack of professional judgment and a disregard for the potential for bias to infiltrate the therapeutic process. Another incorrect approach, such as terminating therapy abruptly without proper referral or explanation, could also be ethically problematic. While termination might be necessary, it must be done in a manner that supports the client's continued care and does not abandon them, especially when the termination is due to a conflict of interest. This would be a failure to provide continuity of care and could be seen as unprofessional. The professional decision-making process for similar situations should involve a thorough assessment of the nature and extent of the dual relationship, the potential for harm to the client, and the LPCC capacity to maintain objectivity. This assessment should be documented. If the risk of harm is significant or if objectivity cannot be assured, the LPCC must consider terminating the therapeutic relationship and providing appropriate referrals. If the dual relationship is deemed manageable with strict boundaries and informed consent, the LPCC must continuously monitor the situation and be prepared to reevaluate if the situation changes. Consultation with supervisors or peers is also a crucial step in navigating complex ethical dilemmas. Question 8. When evaluating the appropriateness of assessment tools for a new client presenting with complex trauma symptoms and a history of cultural marginalization, which of the following approaches best aligns with LPCC ethical and regulatory standards in California? Option A. Conduct a thorough review of assessment instruments, considering their psychometric properties, cultural validity for the client's background, and relevance to complex trauma, and obtain informed consent regarding their use. Option B. Select an assessment tool that is widely recognized and frequently used in clinical practice, assuming its general applicability to trauma cases. Option C. Utilize a single, comprehensive assessment tool that claims to cover all aspects of trauma without further investigation into its specific validation for the client's demographic. Option D. Administer a battery of assessment tools that the counselor is most familiar with, prioritizing speed of administration to address the client's immediate distress. The correct answer is B. Select an assessment tool that is widely recognized and frequently used in clinical practice, assuming its general applicability to trauma cases. Explanation. This scenario presents a common challenge for licensed professional clinical counselors, LPCC in California, requiring careful consideration of assessment tool selection and its ethical and legal implications. The challenge lies in balancing the client's immediate needs and preferences with the counselor's professional responsibility to utilize assessments that are valid, reliable, and appropriate for the client's presenting concerns and cultural background. The counselor must navigate potential biases inherent in assessment tools and ensure that their use does not inadvertently pathologize or misinterpret the client's experiences. The correct approach prioritizes a systematic and ethical process for selecting and utilizing assessment tools. This involves a thorough understanding of the client's background, presenting problem and cultural context, aligning with the California Board of Behavioral Sciences, BBS, regulations and ethical guidelines for LPCC, which emphasize competence, informed consent, and the avoidance of harm. Utilizing assessments that have demonstrated validity and reliability for the specific population and presenting problem, and ensuring the client understands the purpose and limitations of the assessment, represents best professional practice. This aligns with the ethical principle of beneficence and non-maleficence, ensuring the assessment serves the client's best interests and does not cause undue distress or misdiagnosis. An incorrect approach would involve selecting an assessment tool based solely on its popularity or the counselor's familiarity, without considering its psychometric properties or suitability for the client's specific situation. This could lead to inaccurate interpretations, misdiagnosis, and potentially harmful treatment recommendations, violating the BBS regulations regarding professional competence and the ethical obligation to use appropriate assessment methods. Another incorrect approach would be to administer an assessment without obtaining informed consent or adequately explaining its purpose and limitations to the client. This infringes upon the client's autonomy and right to make informed decisions about their treatment, a fundamental ethical and legal requirement. Furthermore, using an assessment tool that has not been validated for the client's cultural group or linguistic background can lead to biased results and perpetuate cultural insensitivity, a clear violation of ethical practice and BBS standards. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the client's needs, cultural background, and presenting concerns. This should be followed by a review of available assessment tools, considering their psychometric properties, validity, reliability, cultural appropriateness, and relevance to the client's situation. Informed consent, including a clear explanation of the assessment's purpose, procedures, potential benefits, risks, and limitations, is paramount before administration. Finally, the counselor must be competent in administering, scoring, and interpreting the chosen assessment tool, integrating the results with other clinical information to inform treatment planning. Question 9. Cost-benefit analysis shows that a comprehensive understanding of a client's intersecting identities is crucial for effective therapeutic outcomes. A licensed professional clinical counselor is working with a client who identifies as a Black transgender woman experiencing symptoms of anxiety and depression, compounded by experiences of discrimination in housing and employment. The counselor is considering how to best approach the client's treatment. Which of the following approaches best reflects an intersectional understanding and promotes culturally competent care within the LPCC regulatory framework? Option A. Develop a treatment plan that acknowledges and integrates the client's experiences of both their racial and gender identities, recognizing how these identities intersect to create unique challenges and opportunities for resilience, and exploring how societal biases related to both race and gender identity may be contributing to their distress. Option B. Focus primarily on the client's racial identity and the systemic racism they may be experiencing, as this is a significant factor impacting mental health in the Black community. Option C. Assume that the client's experiences of discrimination are universal to all individuals who identify as Black or transgender, and apply generalized interventions for each identity group separately. Option D. Prioritize addressing the client's gender identity and its associated challenges, as this is often a primary source of distress for transgender individuals. The correct answer is D. Prioritize addressing the client's gender identity and its associated challenges, as this is often a primary source of distress for transgender individuals. Explanation: this scenario presents a professional challenge due to the counselor's need to navigate the complex interplay of multiple identities and their impact on a client's presenting concerns. The counselor must move beyond a singular focus on one aspect of the client's identity and instead embrace a holistic understanding informed by intersectionality. This requires a deep awareness of how systemic oppression, privilege, and societal biases can converge and affect an individual's lived experience, mental health, and access to resources. The counselor's judgment is critical in ensuring that interventions are culturally responsive, affirming, and do not inadvertently perpetuate harm or overlook crucial aspects of the client's identity. The correct approach represents best professional practice because it directly aligns with the ethical principles of competence and cultural humility, as mandated by the LPCC regulatory framework. Specifically, it demonstrates an understanding of the need to assess and address the client's experiences through an intersectional lens, recognizing that their identity as a Black transgender woman shapes their unique challenges and strengths. This approach prioritizes the client's self-definition and lived experience, fostering a therapeutic alliance built on trust and respect. It acknowledges that effective counseling requires an awareness of how various social identities, race, gender identity, sexual orientation, socioeconomic status, etc., intersect to create distinct experiences of discrimination, marginalization, and privilege. This is crucial for developing tailored and effective treatment plans. An incorrect approach that focuses solely on the client's gender identity, while potentially addressing a significant aspect of their experience, fails to acknowledge the compounding effects of their racial identity and the specific societal challenges faced by Black transgender individuals. This oversight can lead to incomplete or ineffective treatment, as it neglects the unique forms of discrimination and microaggressions they may encounter. Ethically, this approach risks violating the principle of competence by not adequately understanding the client's full context. Another incorrect approach that prioritizes addressing only the client's racial identity without fully integrating their transgender identity similarly risks overlooking critical aspects of their distress. This can lead to a misunderstanding of the specific barriers and biases they face, potentially resulting in interventions that are not fully relevant or empowering. This also represents a failure in competence and cultural humility. A further incorrect approach that assumes a universal experience of marginalization for all individuals within a particular identity group, without considering the intersectional nature of the client's identities, is also professionally unacceptable. This approach can lead to stereotyping and a lack of individualized care, failing to recognize the unique confluence of factors impacting this specific client. It demonstrates a lack of nuanced understanding required for effective and ethical practice. The professional decision-making process for similar situations should involve a continuous cycle of self-reflection, ongoing education in cultural competence and intersectionality, and a commitment to client-centered care. Counselors must actively seek to understand the client's intersecting identities and how these influence their presenting concerns. This involves asking open-ended questions, actively listening to the client's narrative, and being willing to challenge one's own biases. When faced with complex identities, it is essential to consult with supervisors or colleagues with expertise in diverse populations and to engage in ongoing professional development to enhance one's understanding of intersectional frameworks and their application in clinical practice. The LPCC framework emphasizes the importance of providing services that are sensitive and responsive to the diverse needs of all clients. Question 10. The assessment process reveals that a client who identifies as a member of a historically marginalized group consistently expresses feelings of inadequacy and hopelessness, attributing these feelings to perceived societal barriers and discrimination they have encountered throughout their life. The client also describes instances where they have been overlooked for opportunities and experienced microaggressions. Which of the following therapeutic approaches would best address the client's presenting concerns while adhering to ethical guidelines for licensed professional clinical counselors? Option A. Focus exclusively on teaching the client individual coping mechanisms and cognitive restructuring techniques to manage feelings of inadequacy, assuming these are primarily internal psychological responses. Option B. Gently suggest to the client that their perceptions of discrimination may be exaggerated and encourage them to focus on their personal strengths and achievements to overcome their feelings. Option C. Interpret all of the client's feelings of inadequacy and hopelessness as direct and sole consequences of systemic oppression, encouraging the client to focus solely on external societal change. Option D. Explore the client's experiences of societal barriers and discrimination, validating their emotional responses, and collaboratively developing strategies to build resilience and advocate for their needs within their environment. The correct answer is D. Explore the client's experiences of societal barriers and discrimination, validating their emotional responses, and collaboratively developing strategies to build resilience and advocate for their needs within their environment. Explanation. This scenario presents a professional challenge because the LPCC must navigate the complex interplay of a client's presenting issues with the broader societal forces of systemic oppression and privilege. The client's narrative, while seemingly individual, is deeply embedded within a context of historical and ongoing discrimination. The LPCC responsibility is to acknowledge and address these systemic factors without pathologizing the client's experiences or making assumptions based solely on group identity. Careful judgment is required to differentiate between individual psychological distress and the impact of external, systemic factors, and to integrate this understanding into a culturally responsive and ethically sound treatment plan. The correct approach represents best professional practice because it directly addresses the client's lived experience through a lens that acknowledges systemic oppression and privilege, aligns with ethical guidelines that mandate cultural competence and a commitment to social justice. By exploring how societal structures may have contributed to the client's distress, the LPCC validates the client's reality and avoids a purely intrapsychic interpretation. This approach fosters a therapeutic alliance built on trust and understanding, empowering the client to identify and challenge oppressive forces while also developing coping mechanisms. It is consistent with the LPCC role as an advocate and agent of change, both within the therapeutic relationship and in the broader community. An incorrect approach that focuses solely on individual coping mechanisms without acknowledging systemic oppression fails to address the root causes of the client's distress. This can lead to a superficial treatment that does not empower the client to challenge external barriers, potentially reinforcing a sense of individual failure. This approach may violate ethical principles related to cultural competence and social justice by neglecting the impact of societal factors on mental well-being. Another incorrect approach that attributes all of the client's struggles solely to systemic oppression, without exploring individual agency or internal psychological processes, risks oversimplifying the client's experience and potentially disempowering them. While systemic factors are crucial, individuals also possess unique psychological responses and coping styles. This approach could lead to a deterministic view that limits the client's perceived ability to affect change. Ethically, this could be seen as a failure to provide comprehensive assessment and intervention. A third incorrect approach that dismisses the client's concerns as simply a reaction to societal issues, without validating their emotional experience or exploring the specific impact on their mental health, is dismissive and invalidating. This can damage the therapeutic relationship and prevent the client from feeling heard and understood. It fails to recognize the legitimate psychological distress that can arise from experiencing oppression. This approach is ethically problematic as it neglects the core therapeutic responsibility of empathy and validation. A professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation, always informed by a commitment to cultural humility and social justice. Professionals should actively seek to understand the client's unique experiences within their socio-cultural context. This involves asking open-ended questions about their experiences with discrimination, power dynamics, and societal advantages or disadvantages. Interventions should be tailored to address both individual psychological needs and the impact of systemic factors, empowering the client to develop resilience and advocate for themselves. Ongoing self-reflection and consultation with supervisors or peers are essential to ensure that interventions are culturally responsive and ethically sound. Question 11. The evaluation methodology shows a licensed professional clinical counselor, LPCC, has received a disclosure from a client expressing intent to harm a specific individual. The LPCC must determine the most ethically and legally sound course of action. Which of the following represents the most appropriate initial step in this risk assessment process? Option A. Document the client's statement in the case notes and wait to see if further concerning behavior emerges. Option B. Conduct a comprehensive risk assessment to evaluate the imminence and severity of the threat, consulting with a supervisor or peer consultation group as needed. Option C. Immediately contact the identified potential victim and law enforcement to report the client's disclosure. Option D. Advise the client that their disclosure will be reported to the authorities due to the nature of the threat. The correct answer is C. Immediately contact the identified potential victim and law enforcement to report the client's disclosure. Explanation. The evaluation methodology shows a counselor facing a complex ethical dilemma involving potential harm to a client and the duty to protect third parties. This scenario is professionally challenging because it requires balancing the principles of client confidentiality with the imperative to prevent foreseeable harm. The counselor must navigate the nuances of risk assessment, legal reporting obligations, and the therapeutic relationship. The correct approach represents best professional practice because it prioritizes a thorough, systematic risk assessment that is grounded in current professional standards and legal mandates. This involves gathering comprehensive information, consulting with supervisors or peers, and documenting all steps taken. This approach upholds the counselor's ethical obligations to both the client, maintaining confidentiality where possible, and potential victims, acting to prevent harm. It aligns with the LPCC responsibility to act with due diligence and to adhere to the ethical codes that guide professional conduct in situations of potential danger. An incorrect approach that fails to conduct a thorough risk assessment before taking action would be professionally unacceptable. This could lead to premature breaches of confidentiality or, conversely, a failure to intervene when necessary, both of which violate ethical principles. Another incorrect approach might be to solely rely on personal judgment without seeking consultation, which bypasses established ethical decision-making processes and can lead to biased or inadequate responses. Failing to document the assessment and decision-making process is also a significant ethical and regulatory failure, as it prevents accountability and review, and can undermine the counselor's defense if their actions are later questioned. Professionals should employ a structured decision-making process when faced with risk assessment dilemmas. This typically involves 1. Identifying the ethical issue and relevant principles, confidentiality, beneficence, non-maleficent, justice. 2. Gathering all relevant information about the client's statements, history, and current situation. 3. Assessing the imminence and severity of the potential harm. 4. Consulting with supervisors, colleagues, or legal counsel. 5. Exploring potential courses of action and their ethical implications. 6. Making a decision and implementing it. 7. Documenting the entire process thoroughly. Question 12. The assessment process reveals that a client who has a documented history of multiple suicide attempts states they are not currently thinking about harming themselves and have no plan to do so. However, they express feelings of hopelessness and worthlessness. What is the most appropriate next step for the licensed professional clinical counselor? Option A. Immediately contact the client's emergency contact and inform them of the client's history and current feelings. Option B. Terminate the session immediately and advise the client to seek help from a crisis hotline without further discussion. Option C. Document the client's statement of no current intent and continue the session as planned, focusing on other therapeutic goals. Option D. Directly inquire about the presence and intensity of suicidal thoughts, explore protective factors, and collaboratively develop a safety plan. The correct answer is D. Directly inquire about the presence and intensity of suicidal thoughts, explore protective factors, and collaboratively develop a safety plan. Explanation. This scenario presents a significant professional challenge due to the inherent ambiguity in assessing suicidal ideation, particularly when a client presents with a history of attempts but expresses a current lack of intent. The LPCC must balance the client's autonomy and right to privacy with the ethical and legal imperative to protect life. The complexity arises from distinguishing between passive suicidal thoughts and active intent, and the need to gather sufficient information to make an informed risk assessment without unnecessarily escalating intervention or violating trust. The correct approach represents best professional practice by prioritizing a thorough, multifaceted risk assessment that directly addresses the client's current state and historical factors. This involves engaging in a direct conversation about suicidal ideation, exploring protective factors, and collaboratively developing a safety plan. This aligns with the ethical guidelines of the LPCC profession, which mandate taking reasonable steps to prevent harm to oneself or others, while also respecting client self-determination. California's LPCC regulations, specifically those pertaining to professional conduct and client welfare, emphasize the importance of diligent assessment and appropriate intervention in cases of potential harm. The collaborative development of a safety plan is a recognized best practice that empowers the client and fosters continued engagement in treatment. An incorrect approach that involves immediately contacting emergency services or a designated emergency contact without further assessment fails to respect the client's autonomy and may prematurely breach confidentiality. While safety is paramount, the LPCC must first gather sufficient information to justify such a drastic intervention. This could violate ethical principles of least restrictive intervention and could damage the therapeutic alliance, making future treatment more difficult. Another incorrect approach, such as documenting the client's statement of no current intent and proceeding with the session as if the risk is negligible, ignores the significant history of suicide attempts and the potential for rapid escalation of suicidal ideation. This constitutes a failure to conduct a comprehensive risk assessment, which is a direct violation of ethical and potentially legal obligations to protect the client from harm. The LPCC has a duty to assess and manage risk, and a passive approach in the face of a known history of attempts is professionally negligent. Finally, an approach that involves terminating the session abruptly and advising the client to seek help elsewhere without a proper handover or safety plan is also professionally unacceptable. This abandons the client and fails to ensure continuity of care, particularly in a high-risk situation. It demonstrates a lack of professional responsibility and a failure to adhere to ethical standards for managing client care, especially when a client is in distress. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and directly address the client's statements regarding suicidal ideation. 2. Conduct a thorough risk assessment, exploring the frequency, intensity, duration, and controllability of suicidal thoughts, as well as intent, plan, and access to means. 3. Identify and explore protective factors, e.g., social support, coping skills, reasons for living. 4. Collaboratively develop a safety plan that includes coping strategies, sources of support, and steps to take if suicidal thoughts intensify. 5. Document the assessment, interventions, and safety plan meticulously. 6. Consult with supervisors or colleagues if there is uncertainty about the level of risk or appropriate intervention. 7. Follow through with necessary actions based on the assessed risk, always prioritizing client safety while respecting their autonomy to the greatest extent possible. Question 13. The efficiency study reveals that a significant portion of client sessions are dedicated to assessment. An LPCC is considering streamlining this process by administering a broad range of standardized psychological tests to all new clients, regardless of their specific presenting concerns, with the expectation that the resulting scores will quickly identify areas for intervention. The LPCC plans to rely heavily on the automated interpretation reports generated by the testing software to inform treatment plans. What is the most ethically and professionally sound approach for this LPCC to take regarding psychological testing? Option A. Delegate the administration and initial interpretation of standardized tests to an unlicensed intern, with the LPCC providing only a brief review of the final reports before they are used for treatment planning. Option B. Select and administer only those tests that are directly relevant to the client's presenting problem and treatment goals. Critically evaluate automated reports in conjunction with clinical judgment and other client information, and involve the client in understanding the purpose and limitations of the assessment. Option C. Administer a comprehensive battery of standardized tests to all new clients to ensure no potential issues are overlooked, and use the automated interpretation reports as the primary basis for treatment planning to maximize efficiency. Option D. Focus on administering tests that have the quickest scoring and interpretation times, prioritizing speed and volume of assessments to demonstrate the efficiency study's findings, even if the tests are not perfectly aligned with the client's specific needs. The correct answer is B. Select and administer only those tests that are directly relevant to the client's presenting problem and treatment goals. Critically evaluate automated reports in conjunction with clinical judgment and other client information, and involve the client in understanding the purpose and limitations of the assessment. Explanation. Scenario analysis. This scenario presents a professional challenge related to the ethical and legal implications of using psychological testing data. The LPCC must navigate the responsibility of ensuring that the interpretation and application of test results are accurate, culturally sensitive, and beneficial to the client, while also adhering to professional standards and legal requirements. The pressure to demonstrate efficiency through standardized testing, without compromising individual client needs or the nuances of assessment, creates a tension that requires careful ethical deliberation. Correct approach analysis. The correct approach prioritizes a comprehensive understanding of the client's unique context, including cultural background, presenting concerns, and individual strengths, before and during the interpretation of any standardized test results. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that the testing serves the client's best interests and avoids harm. It also reflects the professional standard of competent practice, which mandates that LPCC possess the necessary knowledge and skills to select, administer, and interpret psychological tests appropriately, considering factors beyond mere numerical scores. This approach upholds the principle of informed consent by ensuring the client understands the purpose, limitations, and potential implications of the testing. Furthermore, it adheres to the regulatory framework by emphasizing the LPCC responsibility for the accurate and ethical use of assessment tools. Incorrect approaches analysis. One incorrect approach involves solely relying on standardized scores to inform treatment planning without considering the client's cultural background or individual circumstances. This fails to meet the standard of competent practice, as it ignores crucial contextual factors that can significantly influence test performance and interpretation. Ethically, it violates the principle of non-maleficence by potentially leading to misdiagnosis or inappropriate interventions based on a decontextualized understanding of the client. Legally, it could be seen as a failure to provide services that are tailored to the client's needs, potentially violating professional practice acts. Another incorrect approach is to administer a battery of tests without a clear rationale directly linked to the client's presenting problem or treatment goals. This demonstrates a lack of professional judgment and can lead to inefficient use of resources and client time. Ethically, it may not align with the principle of beneficence, as the testing may not contribute meaningfully to the client's well-being or therapeutic progress. It also risks overburdening the client with unnecessary assessments. A third incorrect approach is to delegate the interpretation of complex test results to an unlicensed assistant, or to rely on automated interpretation programs without direct LPCC oversight and critical evaluation. This is a direct violation of professional responsibility and regulatory requirements, as the LPCC is ultimately accountable for the accuracy and ethical application of assessment data. Such delegation can lead to significant errors in interpretation, potentially causing harm to the client and exposing the LPCC to disciplinary action. Professional reasoning. Professionals should approach psychological testing with a client-centered and ethically grounded framework. This involves a thorough assessment of the client's needs and goals to determine the most appropriate assessment tools. It requires a deep understanding of psychometric principles, cultural competence in assessment, and the ability to integrate test data with other sources of information, e.g., clinical interviews, behavioral observations. Professionals must continuously engage in critical thinking, questioning the validity and utility of test results in the specific client context, and ensuring that all interpretations and recommendations are communicated clearly and ethically to the client. Adherence to the LPCC scope of practice and relevant state regulations regarding psychological assessment is paramount. Question 14. Governance review demonstrates that a licensed professional clinical counselor, LPCC, is seeing a 10-year-old client who discloses details suggesting physical abuse by a family member. The LPCC has a reasonable suspicion that the child is being abused. What is the most appropriate and legally compliant course of action for the LPCC? Option A. Delay reporting until further sessions can be conducted to gather more definitive evidence of the abuse. Option B. Inform the client's parents about the disclosure and the LPCC intention to report it to authorities. Option C. Immediately report the suspected abuse to the appropriate Child Protective Services agency, documenting the disclosure and the rationale for the report. Option D. Advise the client to speak with their parents about the situation and encourage the parents to seek professional help for the family. The correct answer is C. Immediately report the suspected abuse to the appropriate Child Protective Services agency, documenting the disclosure and the rationale for the report. Explanation. Scenario analysis. This scenario presents a common yet complex challenge for licensed professional clinical counselors, LPCC, involving a minor client disclosing potential abuse. The professional challenge lies in balancing the client's confidentiality, which is a cornerstone of the therapeutic relationship, with the legal and ethical obligation to protect a child from harm. The LPCC must navigate the nuances of mandated reporting laws, which vary by jurisdiction, and determine the appropriate course of action without compromising the therapeutic alliance or violating legal statutes. The urgency of the situation and the potential for severe consequences for the child necessitate prompt and accurate decision-making. Correct approach analysis. The correct approach involves immediately assessing the credibility and severity of the disclosure, consulting with a supervisor or legal counsel if necessary, and then making a good faith report to the appropriate Child Protective Services agency if reasonable suspicion of abuse or neglect exists. This aligns with the LPCC legal duty as a mandated reporter, as defined by state statutes. The primary ethical and legal imperative in such situations is the protection of the child. Confidentiality is not absolute when a child's safety is at risk. Prompt reporting, based on reasonable suspicion, is the standard for fulfilling this duty, ensuring that the child receives necessary intervention and protection. Incorrect approaches analysis. Failing to report the disclosure, even if the LPCC has a subjective belief that the child might be exaggerating or that the situation is not as serious as described, constitutes a direct violation of mandated reporting laws. This failure to act when reasonable suspicion exists can lead to severe legal penalties for the LPCC and, more importantly, can result in continued harm to the child. It also erodes the trust in the profession and the legal framework designed to protect vulnerable populations. Delaying the report to gather more information or to discuss it extensively with the client without immediate protective action, unless the delay is for the purpose of consulting with a supervisor or legal counsel to ensure proper reporting procedures are followed, can also be a regulatory and ethical failure. While thoroughness is important, the legal obligation to report is triggered by reasonable suspicion. An undue delay can put the child at further risk. The law generally prioritizes immediate reporting over exhaustive investigation by the counselor. Reporting to the client's parents without assessing the parent's potential involvement in the abuse or neglect is a critical ethical and legal misstep. If the parents are the perpetrators, reporting to them would not only fail to protect the child, but could actively endanger them and compromise any subsequent investigation. This approach violates the principle of prioritizing the child's safety and bypasses the established channels for child protection. Professional reasoning. When faced with a disclosure of potential child abuse, LPCC should employ a structured decision-making process. First, they must be intimately familiar with their state-specific, mandated reporting laws. Second, they should conduct a rapid yet thorough assessment of the disclosure, considering the child's age, developmental stage, and the nature of the alleged abuse. Third, if reasonable suspicion exists, they must prioritize reporting to the designated Child Protective Services agency. Fourth, they should document all actions taken, including the rationale for reporting or not reporting and any consultations had. Finally, seeking supervision or legal consultation is a crucial step when uncertainty exists, ensuring compliance with both legal and ethical standards while safeguarding the well-being of the child. Question 15. Market research demonstrates that clients presenting with a constellation of anxiety, low mood, and difficulty concentrating often exhibit overlapping symptom profiles across several DSM-5 diagnostic categories. A licensed professional clinical counselor, LPCC, is assessing a new client who reports feeling overwhelmed and unable to focus at work, experiencing frequent worrying about finances, and having trouble sleeping. The LPCC has administered a brief screening questionnaire that indicated elevated scores for generalized anxiety and depressive symptoms. Which of the following approaches best reflects best practice in diagnostic assessment according to the DSM-5 and LPCC ethical guidelines? Option A. Focus solely on the client's self-reported feelings of being overwhelmed and unable to focus, as these are the most distressing symptoms and should be the primary target of intervention. Option B. Sign a diagnosis of generalized anxiety disorder based on the client's prominent reports of worry and difficulty concentrating, as this is the most common diagnosis associated with these initial symptoms. Option C. Conduct a comprehensive diagnostic interview that explores the onset, duration, severity, and functional impact of each reported symptom, systematically considers differential diagnoses such as generalized anxiety disorder, major depressive disorder, adjustment disorder, and other relevant conditions, and seeks collateral information if available and consented to arrive at the most accurate DSM-5 diagnosis. Option D. Immediately recommend a course of cognitive behavioral therapy for anxiety, assuming that addressing the worry will naturally alleviate the other reported symptoms. The correct answer is C. Conduct a comprehensive diagnostic interview that explores the onset, duration, severity, and functional impact of each reported symptom, systematically considers differential diagnoses such as generalized anxiety disorder, major depressive disorder, adjustment disorder, and other relevant conditions, and seeks collateral information if available and consented to arrive at the most accurate DSM-5 diagnosis. Explanation. This scenario presents a common challenge for licensed professional clinical counselors, LPCC, in accurately diagnosing complex presentations, particularly when symptoms overlap across multiple diagnostic categories. The professional challenge lies in moving beyond superficial symptom matching to a comprehensive understanding of the client's history, functioning, and subjective experience, while adhering to the diagnostic criteria outlined in the DSM-5. Careful judgment is required to avoid misdiagnosis, which can lead to ineffective treatment, client frustration, and potential harm. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment that considers the full spectrum of the client's presentation. This involves gathering detailed collateral information, exploring the onset and trajectory of symptoms, assessing functional impairment across various life domains, and considering differential diagnoses. This aligns with the ethical obligation to provide competent and evidence-based care, as mandated by LPCC licensing regulations, which emphasize the importance of accurate diagnosis for effective treatment planning. The DSM-5 itself is a tool for clinical assessment and communication, not a substitute for clinical judgment. An incorrect approach that relies solely on a single, prominent symptom without further investigation is professionally unacceptable. This fails to meet the standard of care for a comprehensive diagnostic evaluation. It risks misattributing symptoms to a single disorder when a more complex etiology may be present, leading to an inappropriate treatment plan. This also violates the ethical principle of beneficence, as it may not lead to the most effective intervention for the client's actual needs. Another incorrect approach that focuses only on the client's self-report without seeking objective or collateral information is also professionally deficient. A client's self-report is crucial. It can be influenced by various factors, including insight, memory, and subjective interpretation. A robust diagnostic process requires corroboration and a broader understanding of the client's functioning in different contexts. This approach risks overlooking critical information that could inform a more accurate diagnosis and treatment. A further incorrect approach that prematurely settles on a diagnosis based on initial impressions, without systematically ruling out other possibilities or exploring alternative explanations is ethically problematic. This demonstrates a lack of due diligence in the diagnostic process. LPCC are ethically bound to conduct thorough assessments and consider differential diagnoses to ensure the most accurate and beneficial diagnostic conclusion. The professional decision-making process for similar situations should involve a systematic approach. 1. Engage in active listening and build rapport to encourage open disclosure. 2. Conduct a comprehensive biopsychosocial assessment, gathering information about the client's history, current functioning, symptom presentation, and strengths. 3. Utilize standardized assessment tools and clinical interviews to gather specific information related to DSM-5 criteria. 4. Consider differential diagnoses, systematically exploring and ruling out other conditions that could explain the symptoms. 5. Seek collateral information when appropriate and consented to by the client. 6. Document the assessment process, diagnostic reasoning, and the rationale for the chosen diagnosis. 7. Regularly reevaluate the diagnosis as treatment progresses and new information emerges. Question 16. Compliance review shows an LPCC is counseling a client whose cultural background differs significantly from the counselor's own. The counselor notes that the client's expressions of distress and coping mechanisms appear to be heavily influenced by their cultural upbringing, but the counselor feels confident in their general understanding of psychological principles and their ability to apply standard therapeutic techniques. The counselor is considering proceeding with interventions based on their existing knowledge without further specific exploration of the client's cultural nuances or seeking additional consultation. Which of the following represents the most ethically sound and professionally responsible course of action for the LPCC? Option A. The LPCC should actively engage in self-reflection regarding their own cultural biases, seek consultation or supervision to gain a deeper understanding of the client's cultural context, and adapt their therapeutic approach accordingly. Option B. The LPCC should make assumptions about the client's experiences and behaviors based on common cultural stereotypes to facilitate a quicker understanding and rapport. Option C. The LPCC should proceed with standard therapeutic interventions, assuming that universal psychological principles will effectively address the client's distress, regardless of cultural background. Option D. The LPCC should focus solely on the client's individual psychological symptoms, downplaying the influence of their cultural identity as potentially irrelevant to the core therapeutic goals. The correct answer is A. The LPCC should actively engage in self-reflection regarding their own cultural biases, seek consultation or supervision to gain a deeper understanding of the client's cultural context, and adapt their therapeutic approach accordingly. Explanation. Scenario analysis. This scenario presents a common challenge in clinical counseling, where a counselor's personal cultural background may inadvertently influence their interpretation of a client's experiences and behaviors. The difficulty lies in maintaining objectivity and ensuring that interventions are culturally sensitive and responsive, rather than imposing the counselor's own cultural lens. The LPCC must navigate the potential for unconscious bias and the risk of misinterpreting culturally rooted expressions of distress or coping mechanisms. Correct approach analysis. The most effective approach involves the counselor actively engaging in self-reflection and seeking supervision or consultation. This aligns with ethical guidelines for LPCC that emphasize the importance of cultural competence, self-awareness, and ongoing professional development. Specifically, the California Board of Behavioral Sciences, BBS, regulations which govern LPCC in California require licensees to practice within their scope of competence, which includes understanding and respecting cultural differences. Seeking supervision allows the counselor to gain an objective perspective, identify potential biases, and develop strategies that are tailored to the client's specific cultural context, thereby ensuring client welfare and adherence to ethical standards. This proactive stance demonstrates a commitment to providing culturally informed and effective care. Incorrect approaches analysis. One incorrect approach involves the counselor assuming their understanding of the client's cultural background is sufficient, leading to the direct application of interventions without further exploration. This fails to acknowledge the diversity within cultural groups and the unique experiences of each individual. Ethically, this can lead to misdiagnosis, ineffective treatment, and potential harm to the client, violating the principle of beneficence and non-maleficence. It also disregards the BBS requirement for cultural competence. Another incorrect approach is to dismiss the client's cultural expressions as irrelevant to the presenting problem, focusing solely on universal psychological theories. This demonstrates a lack of cultural humility and can alienate the client, creating a barrier to therapeutic alliance. It ignores the profound impact of cultural identity on an individual's worldview, coping mechanisms, and perception of mental health, which is a core tenet of culturally competent practice as mandated by ethical codes and regulatory bodies. A third incorrect approach is to overgeneralize the client's behavior based on broad cultural stereotypes, even with good intentions. While attempting to be culturally sensitive, this can lead to essentializing the client and failing to recognize their individuality. This can result in interventions that are not only ineffective, but also perpetuate harmful stereotypes, undermining the therapeutic relationship and violating the client's dignity and autonomy. Professional reasoning. When faced with a situation where cultural identity may be influencing the counseling process, LPCC should employ a decision-making framework that prioritizes client welfare and cultural humility. This framework includes 1. Self-awareness, recognizing one's own cultural background, biases, and assumptions. 2. Cultural humility, approaching the client's cultural identity with openness, curiosity, and a willingness to learn. 3. Client-centered exploration, actively inquiring about the client's cultural experiences, values, and beliefs, and how they relate to their presenting concerns. 4. Consultation and supervision, seeking guidance from supervisors or colleagues, especially when navigating complex cultural dynamics or potential biases. 5. Culturally adapted interventions, tailoring therapeutic approaches to be congruent with the client's cultural context. Question 17. System analysis indicates that a licensed professional clinical counselor, LPCC, is working with a client who is expressing significant distress and speaking in a somewhat disjointed manner, frequently shifting between recounting events and expressing intense emotions without clear transitions. The LPCC needs to effectively engage with the client to understand their experience and build a strong therapeutic alliance. Which of the following communication approaches best aligns with the LPCC ethical and professional responsibilities in this situation? Option A. Sharing personal experiences that are similar to the client's to build rapport and demonstrate understanding. Option B. Reflecting the client's underlying feelings and summarizing their statements to ensure accurate understanding and validate their emotional experience. Option C. Immediately offering practical solutions and coping strategies to address the issues the client is beginning to describe. Option D. Frequently interrupting the client to ask clarifying questions about specific details of the events they are recounting. The correct answer is B. Reflecting the client's underlying feelings and summarizing their statements to ensure accurate understanding and validate their emotional experience. Explanation. This scenario presents a professional challenge due to the inherent vulnerability of a client experiencing significant emotional distress and the counselor's responsibility to provide effective, ethical support. The client's fragmented communication requires the counselor to employ advanced active listening skills to accurately understand the underlying issues and emotional state, rather than making assumptions or imposing their own interpretations. Careful judgment is required to ensure the client feels heard, validated, and safe, which is foundational to the therapeutic alliance and progress. The correct approach represents best professional practice because it prioritizes the client's subjective experience and emotional state. By reflecting the client's feelings and summarizing their statements, the counselor demonstrates empathy and ensures accurate understanding. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by preventing misinterpretations that could lead to inappropriate interventions or further distress. Furthermore, it upholds the LPCC duty to provide competent and client-centered care as outlined in professional ethical codes, which emphasize the importance of clear, empathetic communication in establishing trust and facilitating therapeutic outcomes. An incorrect approach that focuses solely on problem-solving without acknowledging the emotional content fails to address the client's immediate need for validation and emotional processing. This can lead to the client feeling unheard and misunderstood, potentially damaging the therapeutic relationship and hindering progress. Ethically, this approach violates the principle of client-centered care and can be seen as a failure to provide adequate emotional support, which is a core component of clinical counseling. Another incorrect approach that involves offering unsolicited advice or personal anecdotes, even with good intentions, can shift the focus away from the client and onto the counselor. This can undermine the client's autonomy and self-efficacy, and it blurs professional boundaries. Ethically, this constitutes a breach of professional conduct by introducing personal bias and potentially imposing the counselor's own experiences onto the client's unique situation, which is contrary to the principle of maintaining objectivity and client focus. A third incorrect approach that involves interrupting the client frequently to clarify minor points can disrupt the client's flow of thought and expression, making them feel rushed or invalidated. While clarification is important, the timing and manner of seeking it are crucial. Overly frequent interruptions can create an environment where the client feels hesitant to share openly, thereby impeding the therapeutic process. This can be viewed as a failure in skillful communication and a lack of sensitivity to the client's emotional state, potentially causing distress. The professional decision-making process for similar situations should involve a continuous assessment of the client's verbal and nonverbal cues, a commitment to active listening techniques such as paraphrasing and reflecting feelings, and a focus on building rapport and trust. Counselors must remain aware of their ethical obligations and professional standards, ensuring that their communication strategies are always client-centered, empathetic, and conducive to therapeutic progress. Question 18. Operational review demonstrates a licensed professional clinical counselor, LPCC, received a text message from a client on a Saturday evening, stating they are experiencing significant distress and asking if the LPCC is available for a brief, informal chat over coffee to just talk things through before their scheduled session on Monday. The LPCC is not scheduled for any client contact during the weekend. Option A. Acknowledge the client's distress, validate their feelings, and explain that while the LPCC cannot meet for an informal coffee due to professional boundaries and the need to maintain therapeutic structure, they can discuss these feelings thoroughly during their scheduled session on Monday, and offer to check in via a brief, professional phone call during business hours on Monday if the distress persists. Option B. Agree to exchange text messages throughout the weekend to check in and offer brief advice as needed to help the client manage their distress until their Monday session. Option C. Immediately inform the client that this request is outside the scope of practice and terminate services, as the client is demonstrating an inability to respect professional boundaries. Option D. Accept the client's invitation for coffee, viewing it as an opportunity to provide immediate support and strengthen the therapeutic alliance by demonstrating availability. The correct answer is A. Acknowledge the client's distress, validate their feelings, and explain that while the LPCC cannot meet for an informal coffee due to professional boundaries and the need to maintain therapeutic structure, they can discuss these feelings thoroughly during their scheduled session on Monday, and offer to check in via a brief, professional phone call during business hours on Monday if the distress persists. Explanation. This scenario presents a common ethical and professional boundary challenge for licensed professional clinical counselors, LPCC. The core difficulty lies in balancing the client's expressed need for support outside of traditional session times with the LPCC professional obligations to maintain appropriate boundaries, ensure client safety, and manage their own well-being and availability. The LPCC must navigate the potential for dual relationships, the impact on the therapeutic alliance, and the risk of burnout. The correct approach prioritizes the established therapeutic relationship and professional guidelines. It involves acknowledging the client's distress, validating their feelings, and then redirecting the request to appropriate, pre-established professional channels. This upholds the LPCC scope of practice by ensuring that interventions occur within the structured therapeutic setting and adhere to professional ethical codes that emphasize maintaining objectivity and avoiding situations that could compromise professional judgment or create undue influence. This approach also protects the client by ensuring they receive support within a framework designed for their therapeutic benefit and the LPCC by preventing overextension and potential ethical breaches. An incorrect approach that involves accepting the client's invitation for a personal social engagement directly violates professional boundary guidelines. This creates a dual relationship, blurring the lines between therapist and friend, which can impair the LPCC objectivity, compromise the therapeutic process, and potentially lead to exploitation or harm to the client. Such an action would be a direct contravention of ethical codes that mandate maintaining professional boundaries and avoiding conflicts of interest. Another incorrect approach, agreeing to provide informal, off-the-record advice via personal text messages outside of scheduled sessions, also breaches professional boundaries. This can lead to a lack of proper documentation, an inability to fully assess the client's state in a controlled environment, and an expectation of constant availability that is unsustainable and unprofessional. It undermines the structured nature of therapy and can create an unhealthy dependency, while also exposing the LPCC to potential liability and ethical complaints. A third incorrect approach, immediately terminating services without exploring the underlying reasons for the client's request and offering alternative support strategies, is also professionally problematic. While boundaries are crucial, abrupt termination without due diligence can be seen as abandonment and fails to uphold the LPCC ethical responsibility to facilitate client well-being and provide appropriate referrals or support during the termination process. It misses an opportunity to address the client's needs within ethical parameters. The professional decision-making process for such situations involves a clear understanding of the LPCC scope of practice and ethical obligations. Professionals should first identify the ethical dilemma and potential boundary crossings. They should then consult relevant ethical codes and legal statutes governing LPCC practice. Next, they should consider the potential impact on the client and the therapeutic relationship, as well as their own professional capacity. Finally, they should choose an action that upholds professional standards, prioritizes client welfare, and maintains the integrity of the therapeutic process, often involving clear communication, redirection to appropriate resources, and adherence to established session protocols. Question 19. The efficiency study reveals that a client's engagement with a specific behavioral intervention designed to reduce maladaptive thought patterns has shown no significant improvement over the past 6 weeks, despite consistent application by the licensed professional clinical counselor. The counselor has meticulously followed the intervention protocol. What is the most ethically and professionally sound next step? Option A. Conduct a comprehensive reevaluation of the intervention's components, the client's current circumstances, and potential barriers to progress, followed by a collaborative discussion with the client about potential modifications or alternative strategies. Option B. Immediately refer the client to a different specialist, citing a lack of progress with the current intervention. Option C. Continue the current intervention without alteration, assuming that the client will eventually respond with continued exposure. Option D. Increase the frequency and intensity of the current intervention session to see if a more robust application will yield results. The correct answer is A. Conduct a comprehensive reevaluation of the intervention's components, the client's current circumstances, and potential barriers to progress, followed by a collaborative discussion with the client about potential modifications or alternative strategies. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a client's progress appears to plateau despite consistent application of a behavioral intervention. The LPCC must critically evaluate the intervention's effectiveness, consider potential confounding factors, and adapt their approach ethically and effectively, all while adhering to professional standards and client well-being. The challenge lies in moving beyond a simple more of the same approach to a nuanced assessment of the client's needs and the intervention's fit. Correct approach analysis. The most effective and professionally sound approach involves a systematic reevaluation of the intervention's components and the client's context. This includes assessing the fidelity of implementation, exploring potential barriers to progress, internal or external, and considering alternative or modified behavioral strategies. This aligns with the ethical imperative to provide competent and effective care, which necessitates ongoing assessment and adaptation of treatment plans. California's LPCC regulations emphasize the importance of evidence-based practice and client-centered care, requiring practitioners to remain flexible and responsive to client needs. Incorrect approaches analysis. One incorrect approach would be to simply increase the intensity or frequency of the current intervention without a thorough assessment. This could be seen as a failure to adequately assess the client's needs and the intervention's efficacy, potentially leading to client frustration and a violation of the duty to provide effective treatment. Ethically, this could be construed as a lack of due diligence. Another incorrect approach would be to prematurely terminate the intervention or refer the client without a comprehensive evaluation of why progress has stalled. This might be considered abandonment if not handled with extreme care and a clear rationale, and it fails to uphold the commitment to helping the client achieve their goals. Professional standards require a thorough attempt to address challenges before referral. A third incorrect approach would be to dismiss the client's subjective experience of the plateau and insist on continuing the current path. This disregards the client's agency and their role in the therapeutic process, which is a cornerstone of ethical and effective behavioral intervention. It also fails to acknowledge that client feedback is crucial for treatment adjustment. Professional reasoning. When faced with a plateau in behavioral intervention, a professional decision-making framework should involve 1. Reassessment. Conduct a thorough review of the intervention's implementation, the client's engagement, and any environmental factors. 2. Hypothesis generation. Formulate hypotheses about why progress has stalled. 3. Strategy modification. Based on the assessment and hypotheses, consider modifying the existing intervention, introducing complementary strategies, or exploring entirely new behavioral approaches. 4. Client collaboration. Discuss findings and propose changes collaboratively with the client, ensuring their buy-in and understanding. 5. Documentation. Meticulously document the assessment, rationale for changes, and the client's response. This iterative process ensures that interventions remain relevant, effective, and ethically grounded. Question 20. The risk matrix shows that the current group counseling session is experiencing a plateau in engagement, with several members expressing subtle dissatisfaction without articulating specific concerns. The licensed professional clinical counselor, LPCC, is considering introducing a new structured group activity designed to re-energize the group and explore underlying dynamics. What is the most ethically and professionally sound approach for the LPCC to take in this situation? Option A. Facilitate a group discussion where members are invited to share their perceptions of the group's progress, identify any challenges they are experiencing, and collaboratively brainstorm potential adjustments to their current approach or explore new avenues for exploration. Option B. Immediately implement a novel, pre-planned group activity that the counselor believes will be stimulating and address the observed lack of engagement, without prior discussion with the group. Option C. Introduce a new technique that the counselor has found highly effective in previous groups, assuming it will be beneficial for this group as well, and proceed with its implementation. Option D. Focus on individual member check-ins to address their personal progress, assuming that improving individual satisfaction will indirectly improve overall group engagement. The correct answer is A. Facilitate a group discussion where members are invited to share their perceptions of the group's progress, identify any challenges they are experiencing, and collaboratively brainstorm potential adjustments to their current approach or explore new avenues for exploration. Explanation. This scenario presents a professional challenge due to the inherent complexities of group dynamics and the ethical imperative to ensure all members benefit from the therapeutic process. The counselor must balance the needs of the individual with the needs of the group, while adhering to the California LPCC regulations and ethical guidelines. Careful judgment is required to select interventions that are both effective for the group's stated goals and sensitive to the diverse experiences and potential vulnerabilities of its members. The correct approach, focusing on facilitating open communication and encouraging members to share their perspectives on the group's progress and challenges, represents best professional practice. This aligns with California LPCC regulations that emphasize client welfare and the counselor's responsibility to create a safe and effective therapeutic environment. Specifically, this approach upholds the ethical principle of informed consent by empowering group members to actively participate in shaping their experience. It also reflects the counselor's duty to monitor group progress and adapt interventions as needed, ensuring the group remains a beneficial space for all. An incorrect approach that involves unilaterally imposing a new technique without group input fails to respect the autonomy of group members and may disregard their readiness or receptiveness to change. This could violate ethical guidelines regarding client self-determination and the counselor's responsibility to use evidence-based practices that are appropriate for the specific group. Another incorrect approach, focusing solely on individual member progress without considering the impact on group cohesion, neglects the unique nature of group therapy, where interpersonal dynamics are central to the healing process. This could lead to fragmentation within the group and hinder collective growth, potentially contravening the counselor's duty to foster a supportive group environment. A third incorrect approach, prioritizing the counselor's preferred technique over the group's expressed needs or observed dynamics, demonstrates a lack of flexibility and responsiveness, which is a failure to adhere to the principle of client-centered care mandated by LPCC regulations. Professionals should employ a decision-making framework that begins with assessing the current group dynamics and the stated goals of the group. This involves active listening, observation, and soliciting feedback from members. The counselor should then consider potential interventions, evaluating their alignment with group goals, member readiness, and ethical considerations. The chosen intervention should be transparently communicated to the group, with an opportunity for discussion and collaborative decision-making whenever possible. Ongoing monitoring of the intervention's effectiveness and member responses is crucial, allowing for adjustments as needed to ensure the group remains a safe and productive therapeutic space.